New this morning, the March of Dimes has a wake-up call for our nation's mothers and babies. Early this morning, the March of Dimes released its 10th annual report card on premature birth rates. It shows the national preterm birth rate has grown worse for the second year in a row. It's up 2% over the previous year to 9.8% in 2016. Preterm birth rates worsened in 43 states, including ours, North Carolina. North Carolina got a D on this report card. Broken down by county, Cumberland got an F with 12.1%, and Durham and Wake counties got a C. And joining us this morning with insight on this report and what it means, the president of March of Dimes, Stacey D. Stewart. Good morning, Stacey.
Good morning, Lena.
So let's begin with this startling statistic. Race, obviously not the cause of preterm births, but in our state, the preterm birth rate among black women is 53% higher than the rate among all other women. What do you think is behind this racial disparity?
Well, thank you for having me this morning, Lena. A lot of people may not know, but the March of Dimes is the leading organization for pregnancy and baby health in the country. And as you mentioned, we just issued our 10th annual Premature birth report card, which shows some alarming statistics around the rate of preterm birth, babies born too soon in this country. And as you mentioned, North Carolina has even more alarming information relative to preterm birth across the state. But certainly it is true that for African-American women and other women of color, they bear a disproportionate impact of babies being born too soon. And a lot of the work at the March of Dimes is trying to understand better why this is happening. But it's also important to understand that premature birth, and this is something that a lot of people don't know, is the leading cause of death for children between the ages of 0 to 5. So we believe that it is urgent that we address this issue, that we understand the underlying causes, and that we develop solutions so that every baby can be born healthy.
So you said that you all are looking into some of the reasons and factors behind it. Can you tell us now what you believe some of the contributing factors are to preterm births?
Well, we don't know all the reasons, and we're doing a lot in terms of medical research to understand that better. The March of Dimes is investing millions of dollars to try to ask the best researchers in the country and around the world to help us determine those underlying causes. But we also know that there are some things that would increase the risk of a baby being born too soon. Certainly if a mom is not able to access affordable prenatal care, that can certainly put her and her baby at risk. We also know that if a woman is suffering from chronic diseases like hypertension or diabetes, the more unhealthy a mom is, the more likely it is that the baby could be born unhealthy or be born too soon. And we also know that other risk factors can be in place as well. So if a woman smokes during pregnancy, that can also increase the risk. So we do know that there's some things that women can do, but let's be really clear that a woman and a mother who wants to make sure her baby is born healthy will do everything possible to make sure that that happens. But unfortunately, what is often too often the case is that women who've done everything possible to make sure the baby is born healthy still sometimes have a baby born too soon. And that's what we have to understand is how can we prevent this for all babies of all races, of all ethnicities, all around the state of North Carolina and around the country.
Well, unfortunately, I have to wrap up this interview because there's so many more questions that I have. But if you all want more information, you can go to marchofdimes.org. Ms. Stewart, thank you so much for joining me this morning.
Former President